Hey guys, so today we're going to talk about how to treat posterior tibial tendonitis. Hey guys, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. Okay guys, if you're just clicking on this video, I'm gonna kind of just jump right into it. If you're a little confused about what I'm talking about, go look at my previous videos where I talk about the causes of PTTD and what PTTD is, because today we're gonna talk about the treatment of PTTD. And in those previous videos, I mentioned stages of PTTD, so we're gonna start right back off with talking about those stages. So, treatment in stage 1 of PTTD which is when your tendon is inflamed and in pain and you have a kind of like a mild flat foot, is more conservative. So treatment in this stage is more shoe gear modification, orthotics, stretching, and icing. And the goal is to give your posterior tibial tendon exterior support so that it doesn't have to work as hard. So your shoes and your orthotics and you stretching takes a lot of the tension off of the posterior tibial tendon, and then it doesn't have to work as hard, so the inflammation around it decreases, so the pain decreases. So in stage 2 of posterior tibial tendonitis, treatment is very similar to stage 1, where you have a shoe gear modification, orthotics, stretching, icing, but other things can also be added in, such as physical therapy and potentially a steroid injection if the pain is really bad. Now the caveat, you guys, with the steroid injection is something you should discuss with your provider, because injecting steroid around a tendon always has a chance of that tendon then rupturing, and some people are comfortable doing it and some people are not comfortable doing it. So that's a really extensive conversation to have with your physician. So during this stage, depending on how bad your pain is and what you've already tried, surgery can also be a treatment option. So surgical treatment in stage 2 will involve more joint sparing procedures, where we would make bone osteotomies or cuts in your bone to reposition your foot in the correct way. Or potentially something called a Kidner, which is where we focus on the tendon only, where we focus only on the posterior tibial tendon versus the entire flat foot. So in stage 3, your flat foot is more rigid, and at this point treatment will consist more of a surgical type of a treatment, where if depending on how rigid your foot is, surgery will likely consist more of joint fusions versus osteotomies. So a joint fusion is like where I would clean out the cartilage on the both ends of the bones and basically fuse them together, versus an osteotomy is where I'd make like a cut in the bone to change the position of the bone. So in stage 3, I would more likely be fusing joints to reposition your foot so it's not flat anymore. And that's stage 3. And in stage 4, which now involves your ankle joint, this will now involve addressing your flat foot and your flat foot being corrected, seeing how that affects your ankle, and then potentially also having ankle surgery, whether that be a total ankle replacement or a fusion. Okay guys, so that is a quick little summary on how to treat posterior tibial tendonitis or posterior tibial tendon dysfunction. If you have questions about it, leave them in the comments section down below. As always, you guys, thank you so much for watching, and don't forget to stretch and subscribe, like this video, and I'll see you guys next week. Bye.